Hello, I am Michael A. Weiss and welcome to the Healthcare Interview. Today we are honored to have the man and doctor behind KevinMD.com, Dr. Kevin Poe. But before we start our chat with Dr. Poe, let me share some of Dr. Poe's accolades, which are quite substantial. He is called social media's leading physician voice. KevinMD.com is the web's leading destination for physician insight on breaking medical news. Clout, that's with a K, Clout, named KevinMD.com the web's top social media influencer in healthcare and medicine. And for those of you who aren't familiar with Clout, it's a company that sort of figured out how to rate the effectiveness of a person or a company in healthcare social media. It's sort of become the de facto standard, but that's quite impressive. Forbes magazine has hailed KevinMD.com as a must-read blog, and CNN has named KevinMD as one of its 5 recommended healthcare Twitter feeds. Now, Dr. Kevin Poe, it's spelled P-H-O, but it's pronounced Poe, is a practicing board-certified internal medicine physician, and I believe he practices in New Hampshire. His commentary regularly appears in USA Today, where he is a member of their editorial board of contributors, as well as on CNN and in the New York Times. His opinion pieces highlight the challenges everyday doctors face, ranging from the primary care shortage to the epidemic of physician burnout. He also is about to share his social media insight in an upcoming book, which I believe is being released in February of 2013, but Dr. Poe will get into that in more detail, and it's tentatively titled Establishing, Managing, and Protecting Your Online Reputation, a Social Media Guide for Physicians and Medical Practices. Dr. Poe, thank you for taking the time to grant me this interview. I know that you're a man and a doctor in great demand, so I sincerely appreciate that. So why don't we just get right to it. You're cited as social media's leading physician voice. So can you explain to our viewers just exactly what healthcare social media is? And for those of you out there who are more familiar with the acronym, because you use Twitter, it's also known by HCSM.
Well, thank you, Michael, for having me on your show. It's truly an honor. Well, when you talk about healthcare social media, some people also call it health communications and social media, HCSM. It simply is the intersection between healthcare and social media. And by social media, we're talking about various platforms like Facebook, Twitter, LinkedIn, blogs, and Google Plus, and the like. And the way I see it is that social media is becoming more and more ingrained in our society. We have a lot of people on Facebook, an increasing number on Twitter, some people on blogs, and they're using social media to share their experience. And I think that's tremendously relevant in healthcare, because whenever I talk to patients, and some of them say that they like to share their stories, share their health experiences on Facebook. And that's actually a trend that's increasing. If you look at the latest data from the Pew Internet and American Life Project, they show that almost a quarter of the patients share their health stories on social networks. And I think that's important because there's a lot of things that I can't necessarily give them in the exam room because I don't have conditions like diabetes or congestive heart failure. I haven't taken a lot of the medications that these patients take, and I've never had an MRI or a PET scan before. But when patients share these stories, they can get that type of support that I can't necessarily give in the exam room. So I think that social media is going to play an increasing role in our health system in bonding patients together and also exacerbating the transparency that we're seeing in other areas of healthcare.
You write and manage the most popular physician blog at www.kevinmd.com, where, and just by way of example for the viewers, here are some of the recent blog entries which caught my eye in terms of topics. The quandary of resident involvement in surgical procedures, and that's written by Dr. Bruce Campbell, January 23rd, 2013. Another topic. It's easier to get an assault weapon than a doctor. That's written by Dr. Pamela Wibble, W-I-B-L-E, and that's dated January 18, 2013. Another one, I Was Sued and Lived to Tell the Tale. That's written by Natasha Denorian, who is a physician and an MBA, and that's dated January 17, 2013. And finally, Doctors Should Return Phone Calls Because It Is the Right Thing to Do, and that's written by a Dr. Miranda Fielding, dated December 27, 2012. So, Dr. Poe, how do you choose the physicians who guest blog on your site? And now that the blog is so popular, when and why do you do the blogging or provide the opinions?
So Kevin MD has been in existence since 2004, and it's gone under several evolutions. Over the past 4 to 5 years, I've invited guest voices to appear on my blog, and they're mostly physicians and other health professionals, but I also have patients share their voice as well, and I have close to 800 to 900 different guest bloggers that post on my site. So the tagline for KevinMD.com is social media's leading physician voice. And when I talk about physician voice, I'm not talking about just my voice, but I'm talking about the voice of other doctors that you may not hear in mainstream media. Because whenever I talk to patients, they often don't know some of the difficulties that healthcare professionals face every day. They don't know what goes on behind the scenes. And I get a lot of comments from patients telling me that they're appreciative of me explaining what doctors go through and some of the difficulties we face when we try to practice medicine. And in the end, both doctors and patients want better care. And sometimes by sharing our difficulties and sharing our experiences that we face that prevents us from giving patients the best care that we possibly could, sometimes we can make changes. Sometimes by sharing these stories, change can happen. So I think I touch on a lot of topics that resonate with both doctors and patients. And I think, on another hand, I also want doctors to hear from patients, too. That's why I invite patients to write on my site. And I get a lot of comments from doctors saying they're appreciative of putting themselves in patients' shoes, because a lot of doctors don't know how difficult it is for patients to traverse our healthcare system and some of the obstacles that they face. So, in the end, it becomes a forum where doctors and patients and doctors and other physicians and patients as well as other patients can share ideas, share their experiences, and hopefully by increasing that transparency, we can overcome some of the obstacles that we face, both doctors and patients, in our health system.
How do you suggest patients use the different healthcare social media platforms to manage their health or, for example, to manage a chronic disease?
Well, I think that patients need to choose a platform that has the best support, meaning the support that has the tipping point in terms of the number of people who share their common interests. Because when it comes to social media, it's only as strong as the number of people who use it. So if a patient who has a specific condition or taking a certain medication finds a platform where they have a lot of other people who share those commonalities, then I would stick with that platform. As a physician, in general, when it comes to social media, I always say that patients have to be careful with what they read online, because more and more patients are going online to look for health information. I believe the latest data is that 72% of patients, of internet users, are going on looking for health information. But last year, they surveyed some of these online patients and found that less than half of them checked the source of what they read online. And when it comes to internet information, there's a lot of information from companies trying to sell products or organizations trying to push their agenda. So patients need to read what they find on the internet with a critical eye. They have to make sure they understand who's funding that website, make sure that it's not overwhelmed with advertisements that could be influencing content. So I always encourage patients to bring it up with me as a physician in the office and ask me, well, what do I think about this information? And I understand that not a lot of doctors may be so receptive to that, but as more and more patients are going online and reading information that may affect their health, I think more of us from the physician and healthcare provider side are going to soon have to accept that patients are becoming more empowered and they are reading that information online. It's becoming a responsibility for us to make sure patients are reading reputable health information online.
That's a very interesting answer, and it begs this follow-up question. In your practice, your private practice over the past couple of years, have you seen a steep increase in discussing healthcare social media with patients? And what percentage would you say of your patients actually bring it up with you?
Well, I haven't been keeping track individually with each patient, but I can say in general, absolutely, there are patients who come to me with questions from information they've read on the web. A few years ago, it used to be printouts from the internet, but now people are just showing me their mobile phones. They're showing me things on tablets of what they've read on the internet, and I'm more than happy to explain what's wrong or what's right about what they read on the web, and to interpret what they read on the web, because a lot of the data that they may see, whether it's from studies or press releases, I think it's not so much data that they have. Patients have access to a lot of data, but I think our value comes in interpreting that data and explaining what that data means to patients and how it can affect their health.
What about doctors using healthcare social media to connect with patients? Given the tricky professional, ethical, and legal, compliance issues and regulatory edicts that physicians must comply with, what's your advice to physicians when they engage with patients in healthcare social media?
I think when it comes to social media, physicians are very cautious because they don't quite know how social media fits into their professional life yet. And whenever doctors hear about social media, it's always from a perspective of risk. You always hear news stories about doctors who get in trouble because they violate patient privacy laws, doctors who get fired because they post pictures on Facebook from patients, and that's made doctors very skittish. So what I try to do on my blog, in my upcoming book, is I try to reframe social media from a more positive perspective. I share stories about how me and my other social media colleagues use social media to guide patients to reputable sources of information, to interpret health studies, to give information, for instance, on the flu vaccine that may bust some of the myths that patients have about that. And I always advise doctors that social media hasn't been evolved to a point where we can talk to patients individually. We need to use social media to talk to patients collectively. And by keeping that in mind, I think that would keep us out of a lot of potential patient privacy issues.